you can control all these things, but the most important thing women should know, because I forget to mention, is that they need to be able to check themselves monthly. Because you can do everything right.
Okay, I think that takes me to the next question, which would be, how do we do these checks? Right, we hear it all the time, self-examination, early detection and stuff like that. But how do we go about these self-checks?
Okay, so the first step is knowing what to look for.
Okay.
Right, because I can demonstrate everything, what you should do, but if you don't know what you're looking for, you don't know what you're looking for. And that brings me to the symptoms. What are the symptoms of breast cancer? When a woman looks at the mirror, she sees her breasts. Many women will tell you that one of their breasts is bigger than the other. That's usually normal, right? Because it's normal. Let me not go into why that. But it's like normal for one to be slightly bigger than the other, or one to be slightly smaller than the other. But when women now notice that, okay, and it's very important for women. I know I'm talking a lot about women, but I've said before that men too can have breast cancer. So men need to pay attention. Anybody that has breast tissue can have breast cancer. But I'll focus more on women because almost all cases are in women. And that's because women have denser and more plentiful breast tissue than men. I mean, by the time a man is having breast like a woman, you know that something's going on. You understand? So what they need to do is know their breasts. If you notice that one is getting maybe rapidly bigger than the other one, that's a sign. Right? Don't ignore it. If you notice that the skin of your breast seems to be changing, like there's this thing we call dimpling, hued orange. But what that means is the breast of the skin may start looking like an orange. You know the way, before you peel an orange, you know the way it looks. It has indentations.
Yes, and like some dots
around this, but you are seeing dots all around. If a woman notices that the skin of her breast starts looking like that, that's very, very important thing to pay attention to. Then other than the breast itself, the areola, that's the dark, the dark place before the nipple. So let's say this breast, you have the areola, then you have the nipple. If you notice in the areola maybe like a rash that was not there before, even if the rash is just there or if it's spreading, please pay attention to it. If you start having discharge from the nipple, whether it's clear or whether it has a tinge of blood or whether it's bloody, or if you notice that the nipple now starts going inside, rather than the nipple pointing like this, it starts retracting. That's also an important thing to notice. You would have noticed that in all of this, I've not mentioned lump, because everybody knows that a lump is this. So the lump is actually number one. But I know that many people who are watching this already know, okay, if you see breast lump, go and see your doctor. So that's why I'm mentioning these other things that people see and don't really pay attention to. But after I've mentioned all this, now go to the top and just put lump, breast lump. Because like I said at the beginning, the abnormal multiplication of cells, it usually gathers and forms that lump, a tumor. Now, in many young women, most breast lumps are not cancerous.
That's very important information, at least good news.
Exactly. So the good news has started coming. So that people know I'm just there to scare all of you. But most breast lumps are not cancerous. In fact, many women between the ages of between their 20s and 30s will tell you that at some point they have seen a lump. Now, this lump is usually of two types, usually. Now, it's important that if you see a lump, you go and see a doctor. Let the doctor be the one to tell you that, oh, this is nothing, don't be worried. What the doctor will most likely do is when you tell him you have a lump, he will look at the lump, examine the lump, and may send you for, say, a mammogram. That's like an X-ray of the breast. or may send you for an ultrasound scan, or may do that and also send you to have a biopsy. What a biopsy is like, they will put a needle inside and get a sample of the tissue that it is made up of. Remember that I said that the lumps that are cancerous are made up of an aggregation of abnormally multiplying abnormal cells. Exactly. So by the time they use a needle to take a sample and look at it under the microscope, they'll be able to tell that, okay, these cells, they don't resemble the one we're supposed to their body. These cells are abnormal. This thing is cancerous. So that's what the doctor will do, right? But many times, most of the lumps that young women see are not breast cancer.
Okay.
By that, I mean that they are not the breast cancer that kills. Because when we talk about tumors, there are two types, the benign and the malignant. Benign are the ones that are not cancerous. I'm looking for a way to put it. The malignant are the ones that will eventually spread if you don't treat it and then cause metastasis. That's the spreading of cancer. Most of the two common types that we usually see are what we call a fibroadenoma and a cyst.
That's big English. Take it out for us.
Let me put it this way. Most breast lumps that young women will see are not going to be cancerous. And they are usually going to be stuff that are not going to spread.
Okay.
They are usually there because of hormonal changes. Like if you talk to many women, they will tell you that during their periods, their breast changes and becomes kind of lumpy-ish. They may touch and they may notice that it's as if someone said they're having a headache. The information I'm giving, is it too much? Okay. So they notice that during their periods, when they touch their breast may feel tender.
Okay.
A slight ache, like I don't know why my breast is feeling as if it's hanging, it's too heavy on my body, that kind of thing. Or they will press it and they may notice maybe like it's a bit lumpy. And then some of them message me that, Doctor, hope I don't have breast cancer, or help my family. And I'll tell, okay, are you seeing your period? This is this. That's why it's important for women to know what their breasts are like.
Okay.
But during pregnancy, many women, their breasts will change as well. Some will say to become bigger, they will not be happy, they will not be carrying. Maybe before it's tangerine they had. So now the thing has become orange. They will not be happy as if people are not they will not be flaunting it. That's why they will not be taking pregnancy shoots like that. They will not pose. They will not say, So yeah, breast changes with the point I'm making is usually with hormonal changes. The woman's breast changes as well. In fact, as she gets older, the breast becomes, I think it has less glandular tissue and more fatty tissue. That's why a woman who hits menopause will notice that the breast changes. It may come down, it may not be pointing the way it was pointing when she was 20. She may even be feeling that, what's going on? You get, so that's it. It's normal, but regardless of all this, any lump that is seen, in as much as it is likely not to be cancer, especially if you are young, please have it checked by a doctor. Okay,
so regardless of whether it is cancer, or you cannot know unless you go to a doctor to get it checked out. Okay, fantastic. So now that you've told us, what to look for, how do we look for it? Can you do?
So the first thing, someone asked a question. What of pain in the armpit? Oh, this is very, very important. Before I go into that, this has reminded me of something I was going to talk about.
Okay.
Remember I